very wonderful. So we can do that for ourselves too. Like
Totally.
what she's doing.
Yes, like what you're doing. What I'm going to do today will be a little bit different than the techniques you were doing. With Shiatsu, one of the principles is that we use direct pressure. So anytime there's a curve or a contour to the ear, we're going 90 degrees perpendicular to it. So if I could show the ear model, grab this one here. So one of the techniques that I do when I'm working with the ear with Shiatsu is that I curve my finger so that I'm always 90 degrees to the angle of the ear. So if you want to try that on yourselves right now, just kind of go in, you might start on a flat surface, and then you find these little ridges, and then turn your fingers so that your fingertip is always this 90-degree angle to the surface of the ear. That's a Shiatsu technique that it can be applied to the ear. But there's other ways you can do it, like you had mentioned, the rubbing points or pulling. It's really nice. On the back of the ear, there's a groove. If you look on this little portion here, there's this line that goes from the top down the back of the middle of the ear. That helps with lowering blood pressure. So you can just kind of gently stroke that in a downward motion. And you can
that point of the blood pressure?
It's this groove. There's a handout here. If you look at this little ear here, this is the back of the ear that gets folded forward. And so it would be this groove back here, and you can just rub that in a downward motion.
Can you show us on the
Towards
model?
the inside of your head or outside of your head?
So kind of straight down in this groove. So if your thumb just lands in this groove, you can just pull down on it. You can also see on that picture of the posterior ear references to the 5 elements. So the 5 elements are one of the bases of our theory of Chinese medicine. Anyone unfamiliar with the 5 elements? Mm-hmm. Okay.
I would.
So we have, right now we're in the element of wood, which is the springtime. And from there we have the fire element. If you can imagine, they're in a circle. We have wood, fire, earth, metal, water. And so this is a cycle and a circle that creates this generating energy, and that all the organs that relate to the elements are all supporting each other. And then if you connect them into a star pattern, you also have this other cycle of interaction with the elements. And so when we are diagnosing, we look at the elements and the correspondences with the elements in terms of how we decide what approaches we're going to take with points, or specifically with ear acupuncture, we'll think about the relationships of the elements with the organs themselves and the meridians. So, who here is familiar with the meridian system? A little bit.
Never have it memorized.
So the meridian system in Chinese medicine reflects the energies that we have in our organ systems, and they run throughout the body in mostly vertical lines throughout the limbs and the torso and up to the head. And so when we think about, say, large intestine, we have that meridian running along here to the nose. And say we have shoulder pain, someone has a hard time bringing their arm up, you can tell that the large intestine meridian is being affected. But maybe it's too painful to put needles in this area, so we might investigate the ear and look particularly at the large intestine point on the ear, as well as shoulder and arm, and maybe neck, because maybe it's radiating up into the neck. So this is a way that we can start to look at the ear in terms of how we can treat the whole body or different parts of the body. So what I do, say someone comes in for shoulder pain, I'll inspect their ear and I'll look for areas of redness, which might be inflammation. The blood vessel might be there. I might choose to needle that blood vessel to allow blood to release. I would also maybe look for dryness. kind of flakiness. Could also look for spots, moles, things like that, any kind of discoloration, any kind of swelling. So those are, observing is a way for me to get diagnostic information. And then to confirm that a point is the right one to needle, I would use an ear probe to press along points of the ear. I might ask, is it tender at 1, 2, or 3? And then needle the one that is most tender. So for that shoulder pain I had mentioned, I would investigate the large intestine meridian for its location, the shoulder area for its body, and then if you can see, this chart doesn't show it very well, but on the inside of this point you can see there's this image here is a representation of this part of the ear with the flaps pulled back. This is looking into that deep part of the ear here. There's this subcortex point, and that relates to the part of the brain that regulates pain. So I will often needle that one as well when there's been pain. So we're combining these different approaches, working with the neuromuscular connections, working with the meridians, working with the local areas to treat pain. And then I'll add in things like the nervous system one to help just with overall relaxation. And there's a nice point called Shenmen. It's kind of in the center of the upper ear. That's a great relaxation point too. So it calms the spirit.
So the lines on the paper are the actual places where
these are like representations of
rising
zones.
Yeah.
Mhm.
So like there's little risers or it goes in or around.
Yeah. So like the ridges, the concha is this inner deeper part. We have the helix is this outer part wrapping all the way around, coming down here. If you look, there's a point called center. It's right in the center of the ear. It's also referred to as point 0. That's a great place to just, if you're feeling scattered, just need a center and kind of ground. If you take your thumbnail and just kind of slide it along that inner ridge that's wrapping around the ear, you'll find a little notch. And if you let your fingers, it might be tender. So you can just kind of press into that, and then you can start to layer in these ideas of microsystems. So if this is the center of the body, you can also think of the navel as the center of the body. So you can just take a deep breath into your navel, feeling that expanding, and then feeling that sense of centeredness. So sometimes when someone comes into a treatment and there's a lot going on, maybe they were stuck in traffic, they're feeling scattered, they got up to the appointment lane, I'll just start off with that point 0, just to let them in the center, recalibrate, helps maintain homeostasis. And so just to kind of go back to this idea of the microsystem, we're working with the holographic principle of the ear, in that, is anyone familiar with holographic photography? So there's this image where you take a picture onto a photographic plate, and it creates a 3-dimensional image. And if you take that photographic plate, break it in half, and take a piece of it, you can still project this 3-dimensional image from it. So this idea that within each part of a whole, each part represents the whole within it. So that's where we have the whole body can be mapped out onto the ear, the scalp, the hands, the feet. And so, let's see. Today, what I'd like to do is offer you some ear shiatsu. So Emden will be going around with a consent form. If you're interested in this, you can fill out, so is there anyone that would like to receive? Okay, so we'll pass that around, and I think what I'll do is bring a chair up here, and I can answer questions as I'm demoing.
What is the helix? 1, 2, 3, 4, 5.
So those are zones. There are a number of zones that can relate to different points, and there's actually different maps that you can use with the ear. So when we think of a hologram, we can superimpose all these different images onto here. So there's actually a French system, there's a Chinese system, but this is what's most commonly used with traditional Chinese medical treatments. So I mentioned pain being helpful for regulating pain and treating pain. Also, we have all the organs, so we can work with internal medicine. There's also points related to the endocrine system, so hormone balancing, fertility, menopause. Those would be things. That endocrine point is this little intertracheal notch here. It's just behind here. So that would be good for someone who's having some endocrine balance. And then allergies. So we're in springtime. Allergies could be a common complaint. So that's this point that's right up here. So if you look where it says apex on here, it's actually just underneath. There's a couple of allergy points. So if you look under this apex is the top part of the ear, the allergy point is up and in here. And there's also a second allergy point that some people have this little groove here called Darwin's tubercle. It's a little extra accessory on here. It's just in this little notch here. So you can, if you have allergies, you can press along, and there's a tender point in that area. You can just rub it, massage it, and that can help with
So
allergies.
this is asthma, is that where you were saying was the other allergy?
The asthma point, I think so the allergy point is where it says apex, at the very top here. Asthma is, there's two asthma points. There's one here and one
On
here.
the exterior, by the ear root.